Welcome to The Explainer. So, if you or maybe someone you love has recently been navigating a type 2 diabetes diagnosis, you know firsthand that the medical jargon can feel like an absolute alphabet soup. I mean, one minute you're hearing about metformin, the next it's Jardians, and then suddenly someone brings up Ozempic. It is totally normal to feel completely confused. But today, we're going to clear all of that up by taking a structured tour through your diabetes medical toolkit. Think of this explainer as your essential, no-nonsense guide to understanding exactly what these tools do and, more importantly, why a doctor might reach for one over another. It's incredibly common to feel overwhelmed when you look at the sheer variety of treatments available out there today. And, it almost always leads to this exact question. You might be wondering why your friend was prescribed a simple daily pill like metformin to start, while someone else in your family was immediately offered a really sophisticated weekly injection. Like, what actually drives those decisions? And compounding all of that confusion is the constant media buzz. We are just bombarded with headlines asking, are the newer drugs really better? Everyone is talking about names like Ozempic, Wegovy, and Mounjaro. And don't worry, we are absolutely going to get to those. But to truly make sense of those buzzy medications, we first need to understand the foundational landscape of how we actually treat diabetes today. Okay, let's lower your cognitive load and dive right in. Here's our game plan. We'll cover why we treat diabetes, the first step with metformin, kidney helpers called SGLT2 inhibitors, boosters and alternatives, the role of insulin, and finally, a side-by-side comparison of all your options. Section 1. Why we treat diabetes, protecting your long-term health. Right out of the gate, it's absolutely crucial that we shift our narrative. Type 2 diabetes isn't just about chasing a lower number on a glucose monitor. When blood sugar stays elevated over many years, the consequences are stark. It significantly increases the risk of heart attacks and strokes. It can literally lead to kidney disease, blindness, severe nerve damage, and really stubborn foot ulcers. So we aren't reviewing these medications just to fix the lab result. Finding the right treatment is absolutely vital to preventing these serious long-term complications and preserving your overall quality of life. But before we pick up a single medical tool, we have to lay down the foundation. Medications are designed to support lifestyle changes, not replace them. A healthy diet, sustainable weight loss, regular exercise, better sleep, and quitting smoking, these are sequential, foundational steps. Without this base, the medications in our toolkit simply cannot do their best work. Section 2. The first step, metformin, the foundational tool. For the vast majority of people diagnosed with type 2 diabetes, metformin is the very first medication prescribed. So how does it actually work? Well, metformin operates on the body's complex glucose system in a couple of brilliant ways. Primarily, it acts on the liver. Your liver is essentially a giant sugar factory, and metformin turns down the production line, reducing the amount of glucose it pumps out. At the exact same time, it improves your body's insulin sensitivity, helping your cells actually absorb the sugar that is already circulating in your blood. Now, what's really interesting when we weigh the pros and cons is that the benefits are heavy. It's inexpensive, highly effective, usually weight neutral, and carries a very low risk of causing low blood sugar, which is called hypoglycemia. But on the side effects side, it definitely can cause digestive upset, things like diarrhea, bloating, and nausea. A great pro tip here is that taking it with food or using a slow-release version often clears those right up. Also keep in mind that long-term use can reduce vitamin B12 levels, so your doctor might need to monitor that, especially if you develop any numbness or tingling. Section 3. Kidney helpers, SGLT2 inhibitors, flushing out the excess. All right, let's keep building our toolkit with a much newer, highly specialized class of medications, the SGLT2 inhibitors. If metformin works on the liver, this next group is specifically designed to target the kidneys. These inhibitors, which include names you might actually recognize like dapagliflozin, empagliflozin, and canagliflozin, are essentially kidney flushers. Instead of just moving sugar around inside the body, these medicines literally change how the kidneys work. They physically remove the problematic excess glucose by flushing it right out of your system through your urine. And because of how they work, they come with some truly incredible secondary benefits. Since you are literally peeing out calories, they promote weight loss. They also lower blood pressure, actively protect the kidneys from damage, and drastically reduce hospital admissions for heart failure. That's a huge deal. But, because there is now all this extra sugar in your urine, the side effects you really need to watch out for include increased urination, urinary tract infections, and genital thrush. Okay, I want to pause here for a second and be incredibly focused because this next point is a critical safety warning. SGLT2 inhibitors can, in rare cases, cause a really dangerous condition called euglycemic diabetic ketoacidosis. This risk massively spikes during severe illness, fasting, dehydration, or if you're having major surgery. It is absolutely imperative that you know your sick day rules and you talk to your doctor about exactly when to temporarily stop taking this medication if you get unwell.
Section 4. Boosters and alternatives. Specialized tools for specific needs.
Of course, not every patient is the exact same, which brings us to alternatives like DPP-4 inhibitors. Doctors might deploy these depending on your unique metabolic situation. Think of medicines like sitagliptin and linagliptin as simple hormone boosters. They work by increasing your body's natural incretin hormones, which then helps manage your blood sugar. The really great thing about these is that they are super well tolerated, simple once-daily tablets, and they're weight neutral. Though it's worth noting they are definitely less effective for weight loss than the highly publicized injectable medications. Then we have some older tools in the kit. Sulfonylureas like gliclazide stimulate your pancreas to just release more insulin. They lower glucose quickly and they're really cheap, but they often cause weight gain and bring a pretty high risk of hypoglycemia. Then there's pioglitazone, another older pill that improves insulin sensitivity, but it can cause weight gain, fluid retention, increase your risk of bone fractures, and even worsen heart failure. Because of these profiles, these older tools are often avoided today if newer, safer options are a good fit for the patient.
Section 5. The role of insulin. Replacing what is lost.
Sometimes, despite absolutely all the best efforts, diet changes, and multiple tablets, diabetes still progresses. And that brings us to insulin. Now, a lot of people fear this stage of treatment, but I really want to reassure you and completely destigmatize this crucial tool. I'd love for you to read this with me. Insulin is not a failure. It simply replaces what the body can no longer produce adequately. Type 2 diabetes is very often a progressive condition. Over time, your pancreas simply gets tired. Needing insulin just means you're giving your body exactly what it needs to stay healthy. Plus, modern insulin regimens are highly safe, incredibly flexible, and honestly, way easier to manage than most people expect. Section 6. Comparing options. The big picture. We have covered a lot of ground today, and this brilliantly illustrates how all these different tools actually stack up against each other. It's a real screenshot moment. Notice how metformin is largely weight neutral with a super low hypo risk. Then look at the SGLT2 inhibitors, offering weight loss and excellent heart and kidney benefits. In contrast, those older sulfonylureas and pioglitazone can actually cause weight gain. And right down at the bottom, we see the GLP-1 class, offering significant weight loss and excellent cardiovascular benefits, all with a remarkably low risk of low blood sugar. Ultimately, the crucial point here is safety. Before we wrap up, we absolutely must establish your safety net. Please, never stop your diabetes medication abruptly without discussing it with your healthcare professional first. And seek urgent medical attention if you develop severe vomiting, persistent abdominal pain, confusion, severe dehydration, or any signs of diabetic ketoacidosis. Your medical team is there to help you navigate these tools safely, so always lean on them. Now, you might have noticed I kind of parked the massive elephant in the room earlier. What about the GLP-1 receptor agonists? Drugs like Ozempic, Wegovy, and Mounjaro have completely transformed diabetes treatment. As we just saw, they lower blood sugar, promote really significant weight loss, and reduce cardiovascular risk in appropriate patients. Because these medicines have become so incredibly popular, they honestly deserve an explainer all to themselves. So, as we look to the future of diabetes care, are these GLP-1s the ultimate silver bullet we've been waiting for, or just another tool in the kit? Well, in our next explainer, we are going to break down exactly who should take them, their real-world weight loss expectations, specific side effects, and we'll bust some massive myths while we're at it. Thank you so much for learning with us today, and we'll see you next time.